Hi, hello, this is Sani, pursuing Physician Assistant at SNS College of Allied Health Science, second year. Today, my topic is about fetus. Introduction. The fetus lies inside the uterus in a closed sac filled with liquor amini. It is enough freedom of movement until the latter moment of pregnancy when it becomes relatively fixed. Till then, periodic examination is essential to note its lie, presentation, position, and attitude. Incidental idea can be gained about the size of the fetus or amount of the liquid amini. Lie. The lie refers to the relationship of long axis of the fetus to the long axis of the centralized uterus or maternal spine. The most common lie begin longitudinal. The lie may be transverse or oblique. Sometimes the lie is unstable until labor sets in when it becomes either longitudinal or transverse. Now the picture shows longitudinal lie and the transverse lie. Presentation. The part of the fetus which occupies the lower pole of the uterus is called the presentation of the fetus. Accordingly, the presentation may be cephalic, podalic, or a shoulder and other. A cephalic is 96.5%, podalic is 3%, or a shoulder and other maybe 0.5%. When more than one part of the fetus present, it is called compound presentation. Presenting part. The presenting part is defined as the part of the presentation which overlies the internal os and it is felt by the examining finger through the cervical opening. Thus, in cephalic presentation, the presenting part may be a vertex, brow, or a face depending upon the degree of flexion of the head. Similarly, the fetal leg is breech presentation may be flexed, extended, or foot may be present. However, the term presentation and presenting part of are often used synonymously and expressed more commonly in clinical practice according to the lateral definition. This picture shows abnormal presentation. Attitude. The relation of the different parts of the fetus to the another is called the attitude of the fetus. The universal attitude is that flexion. During the lateral month, the head, trunk, and the limbs of the fetus maintain the attitude of flexion on all joints and form an ovoid mass that corresponds approximately to the shape of the uterine ovoid. The characteristic flex attitude may be modified by the amount of liquid amni. There may be expectations to the universal attitude and extensions of the head may occur. Vertex, brow, or face presentation according to the degree of extension, or the legs may be extended in breech. The course of labor in such circumstance may be modified accordingly. Denominator. It is a arbitrary bony fixed point on the presenting part which comes in relation with the various quadrants of the maternal pelvis. The following are denominators of the different presentation. Occiput in vertex, metronome in face, frontal eminence in brow, sacrum in breech and acromion in shoulder. Anterior, posterior, right or left position is referred in relation to the maternal pelvis with the mother in erect position. However, some have retained the conventional description of four vertex position. Vertex occupying the left anterior quadrant of the pelvis is the most common one and it is called left occipito-anterior. This is the first vertex position. Similarly, right occipito-anterior is the second vertex, right occipito-posterior is the third vertex, and the left occipital is the fourth vertex position. Thank you.